Today we're going to be talking a little bit about public health communication and how we take public health data to help us understand the world around us so that we can be effective in terms of addressing our healthcare needs in our society. So when we think about these types of questions, one of the main things that we want to consider is how do we get information? Where is this information about health coming from? Well, there's 6 major ways in which we collect initial data in public health. Now, there's a few other ways as well that aren't on this list, which we'll discuss a little bit further. But there's a few major sources. And one of the first ones is single cases and small series. So these types of cases are when we go out and we try and find or we identify specific situations where there's some disease that's popped up in a certain area. So we then go and try and figure out what happened in that circumstance. All right. Or if there's a series of cases in a specific region, we try and understand what's going on in terms of this health event. We also collect a wide range of different statistics, and these statistics are captured at a population level. So, for example, vital statistics, we collect all information about who's born and who dies. And just knowing that basic information can tell us a little bit about, for example, why did they die, right? And what types of reportable diseases, which are diseases that by law you have to report to the CDC so that we can keep track of them. How are they progressing? Are they increasing or decreasing? We also do a lot of different surveys where we collect information from a large portion of the population or some representative portion of the population, and then we get some idea of what's going on for their health. And these surveys can be really helpful. They describe a wide range of different things, from different types of health conditions to different attitudes and beliefs to different types of behaviors which are relevant to health. We also have different types of ways in which people can self-report if they have health-related concerns. So there's cases where certain types of databases around gun violence, they tell police departments, well, you can report if gun violence happens in police citizen sort of interactions, right? Or you can also report if there's an adverse events due to vaccines. This can be useful for getting certain types of information, but self-reported data sometimes is substantially biased because the impetus to actually report something sort of indicates a certain type of interest, or sometimes in some cases lack of interest in providing that type of health information. Then you could also monitor to sort of see sentinel events. So if you know a disease or something is potential risk, you can check and see whether or not it's popping up in the population. So you want to catch that as soon as possible, catch those sentinel events of a disease. The other thing that we do in terms of collecting data and monitoring health at the population level is looking at syndromes. So, for example, if you're interested in flu, you might be interested in looking to see how many people are having the symptoms of the flu. So there you might be looking at things like, are people buying lots of tissues at pharmacies? Well, you could look and see, well, it looks like suddenly there's a spike in this particular area for people selling tissues. And that symptom of having to blow your nose actually can indicate a more serious disease that's spreading in that region. Now, a lot of these data sources are what we call quantitative data, or using numbers to measure something. But in public health, we also really are interested in qualitative data too. So when we identify specific diseases or situations, sometimes we do a lot of work to interview people to understand how they're thinking about that disease, how their thinking influences how they interact with it and their behavior. And there's a lot of sociological and anthropological work that really plays a major contribution to how we understand disease and its spread in populations. And to be honest, there's been many mistakes historically in terms of public health, how we deal with an outbreak or a disease problem, because we don't bother to actually measure how people are responding to this in a more concrete way based upon their own opinions and perspectives on a disease. So, what are a lot of major sources for public health data? Well, there's a whole bunch of them out there. I've lists which you can use to actually find more information out there that might be of interest to you, to projects that you might take on. But here are just a few general sources. So at a global level, if you're interested in getting global data, the World Health Organization is a really great source. They have a lot of different types of data. The World Bank, which we think of as a financial institution, actually has a lot of developmental information about how different countries around the world, what types of economic supports they have in terms of income, in terms of education, in terms of a wide range of different things that are relevant to understanding health in those societies. UNICEF has a lot of information about health, particularly for children, pediatric health, but more generally for different populations. But there's a lot of different sources out there that you can use to learn about global health. At the national level, we have, of course, the CDC, which is the major Center for Disease Control and Prevention, which is a major organization focused on public health interests in the United States. And what the CDC does is they do a lot of that work around monitoring health across the country. They do a lot of these surveys. So the NHANES survey collects a lot of information about different people's health states. And they do this at a very large scale. So they know roughly how many people have different diseases across our entire population. National Health Information Survey, the BRFFS, which is looking at behavioral health. So what are people's attitudes and behaviors with respect to health-related concerns? What types of foods do they eat? How much do they smoke? What are some of their attitudes? Health-related quality of life. There's a whole bunch of different surveys that the CDC puts out that you can actually go to their website and find and collect data to learn about your health issue. And a lot of it you can actually find out for even by state level and sometimes by county level, how different people think about different areas. The National Institutes of Health also is a really great resource. That's the main research institute for health-related concerns in the United States. And it's broken up into over 20 different institutes that focus on different things like eye health or diabetes or heart disease or genetics or geriatric conditions. So you can look at these different areas based upon the diseases that you're particularly interested in. And each of those institutes have data that you might be interested in to look at. For example, I believe the National Cancer Institute, they have a HINT survey, which is a health information survey that looks at people's attitudes towards information and how they engage with, for example, online health information. So that can be really helpful. And a lot of these surveys are really carefully designed so that they've been very well what we call validated, which means that the questions are designed so that people can understand them very easily. They tend to work really well, so they tend to be pretty good data. You can also look at the Department of Health and Human Services. They have AHRQ, for example, where you can look and see they have a lot of information about the healthcare workforce and the finances, sort of how do hospitals, for example, fund healthcare? How are we putting our money into different types of health-related issues? Now then you can descend into the state level. So the state level also has a lot of information that you can access. So the Washington State Department of Health is the main source for state level health resources. And they do a lot of surveys at the state level. They have a lot of data that you can access from the website that you can learn about. And you can also learn more about state priorities with respect to health. Then also at a local level, for example, the Seattle-King County Public Health is a really great resource, or the Snohomish Health District, depending on where you're located. They have information about our local districts, and they can tell us about, how many people in our neighborhoods got HIV last year, what tuberculosis rates are, what types of efforts are at a local level to encourage exercise, for example, right? So they're actually a great resource for local projects and efforts. And they have a lot of information there that you can access if you dig around a little bit. And then at all these different levels, you can also look to non-governmental organizations. So these are nonprofit organizations that are really interested in these issues. And they're also a really useful resource. Now, getting this information, this basic statistical information is really helpful for us just understanding health at a population level. So, for example, if you're just looking at mortality rates, like what people are dying of, you can then break that down based upon the diseases that they're dying of. And if you look at a population level, well, what's really interesting is that a very large portion of the deaths in the United States are really due to two things: heart disease and cancer, right? So if at a public health level you were able to eliminate deaths from heart disease and cancer, you'd have a huge impact on health in our society. That's really what a lot of people are dying of, right? And this is useful information for just knowing what the big hitters are in terms of public health. And this is a list of the top 10 direct causes of death in our society. Now, another way to look at this is looking at risk factors for causes for death. So again, we've talked about the idea that you might die of heart disease, but you might die of heart disease because you smoked and you ate food that was unhealthy, right? So if you actually look at a population level and try and describe what are the risk factors that are causing these mortality and death in the population, well, you find things like dietary risks. You find things like smoking coming up at the top of the list, high blood pressure. These are risk factors that have a huge impact on population health. And there is always this conversation between what should we be focusing on when we're thinking about public health efforts. Do we primarily focus on the cause of mortality directly, or do we focus on these risk factors that are more upstream that we can address to prevent things? So really in public health, we address both of those things. We really are concerned about them. In our public health strategies, we'll use different types of interventions to address them. All right. So that's some ideas around how do we actually get public health information. Well, there's also questions about how do we take that information and then combine it effectively so that we can then start using it to understand in a more refined way what's going on in health at a population level. So there's a few different measures that are very commonly used. One is infant mortality, and another form of that is under 5 infant mortality or childhood mortality. And some of the reasons that we use that is understanding how childhood health can actually be really effective for us understanding the quality of healthcare access and resources. So 50 years ago, infant mortality was a really good measure of public health because looking at death within the first year actually really was a good indicator of maternal health and overall public health in those communities. Unfortunately, infant mortality has a huge impact in society, especially if you look across an entire lifespan. Nowadays, actually, they often use under 5 mortality for children. So because we've actually done a good job of expanding life of children, but things like HIV or other conditions, very often they die in that before 5 years of age. So sometimes this can actually be a better measure at this point of how public health systems are working in different countries. Another common measure is general life expectancy. So here the question is, how long would you expect someone in a population to live on average? And this is again an average measure. So you'll see it ranges widely across different countries. Now, one could also ask a second question. Okay, you could ask, how long do people live? But you could also ask, how good is their quality of life during that lifespan? And that's where they create a measure called the Health Adjusted Life Expectancy, all right, called the HALE. Okay, so what they do is they do measures in different countries across the world to assess things like mental health and how much people are experiencing disability in their life. Can they carry out daily activities? so a wide range of different things that affect people's ability to live in a healthy way in a society. And then they take that measure and they adjust the health adjusted life years. Essentially, they're taking away the negative impact of, or the amount of years that you'd expect people to be living in a substantially disabled state, right? So that's a health adjusted life expectancy. Okay. What this measure does is it gives us a bit of an understanding of how good a public health system is at preventing people from living with a disease for a long period of time. So are people living for a very long time, but they're actually experiencing a lot of disability and health impacts, or are they living perfectly healthy until they die at a normal age, right? And this is a measure that can help us envision this, right? Another measure that's kind of helpful is looking at not just at a country level, but looking more specifically at how many years of potential life is lost for different types of diseases or conditions. So here the question is, if you have a disease, a specific disease that you're interested in, how many years of life would we expect people on average to have lost out of their life if they get that disease and die from it? Okay. So you can actually do measures to see what the impact of this disease is on people's health. Okay. One of the nice things about this is the way that you measure it, you can actually get measures for things like depression and other things that often aren't really well measured in other contexts. That you can actually look at the negative impact on people's overall lifespan of those things, and also the negative impact on their quality of life in that context. You also can do a measure which is called the disability adjusted life years or quality adjusted life years. These are equivalent type terms. They're really similar to one another. So dailies and qualities are both measuring how much of an impact disease has in terms of disability on the quality of life of that year. So you take a year and you could say, if someone has this disease that's really painful or hard, the value of that year could be decreased by down to 7.7. All right. So you're adjusting the impact of a disease on somebody's health within a year. Okay. So these are essentially used for adjusting and combining and trying to measure, get an understanding of our intuitive understanding that how people experience health and how people are impacted by disability influences that someone's life. Okay. There's a lot of interesting questions that go along with this that I'll discuss at a later point. So when we look at things like life expectancy in HALEs, what we'll see is that there's interesting effects. So if you look across different countries, we'll notice that there is a huge difference in terms of life expectancy. Again, this difference in life expectancy going from Nigeria, average age of around 48, up to Japan, where there's an average age of almost 83. Well, that's a huge difference, right? And we don't think that that's genetic or something natural. That's a difference due to public health systems, economics, a whole range of different things that we've talked about previously that impact an overall lifespan in the country, right? You can also look at, again, the HALE, the health adjusted life expectancy. And what you'll see is that also differs across different countries. And what you're looking at there is the difference between the life expectancy and then the health adjusted life expectancy. If you see a larger difference, that means that on average, people in that country, in that population, are experiencing more disability and health impacts throughout their lifespan, perhaps even if they're living longer. So we see for for across these different countries, it ranges from about 7 or 8 years up to as much as 12 or more years. So there can be real differences across countries in terms of how people are experiencing health. We can also break out HALEs in terms of understanding a little bit about how it breaks up across different types of diseases. And you can rank different countries based upon how well they're doing in addressing different health impacts. Now, this is a very large study that the Burden of Disease collaboration, which essentially looked across a lot of different countries and measured it across diseases. And they took an average score for how well countries are managing different types of health conditions. And when you look at the countries as compared to that average score, what we find is that the United States actually isn't doing that great. When you look at things ranging from ischemic heart disease to interpersonal violence to things like breast cancer, to a whole range of different factors, it actually turns out that the United States has many different ways in which we could actually be improving our public health systems to ensure that people aren't suffering from these different diseases. So we have a long ways to go within the United States. There's something else that's really also helpful in terms of understanding health at a population level, especially internationally. And these are phenomena that go on within populations. So what you see is that there can be demographic transitions. And demographic transitions are how different age structures within different populations will influence the different types of health that populations have. So, for example, in the United States, we have a baby boomer population, which is rapidly approaching the age where they're going to start experiencing a lot of chronic diseases that have major health impacts. So heart diseases and cancers in particular. So we can expect that we're going to start seeing a lot more of them in terms of health impacts at a population level in a short period of time. Whereas other populations where you have a lot more young children, for example, you're going to be worrying more about accidents or things like suicide or other things that are more of a problem for younger populations. So by understanding how these transitions occur as population structure changes over time can actually tell us a lot about the health of a society. There's also something called the epidemiological transition. All right. So as public health systems improve overall in a country, what we have seen, generally speaking, is that there's a transition from people dying more frequently of communicable diseases, infectious diseases, to, as it becomes more developed, to more frequently dying of non-communicable diseases like heart disease and cancer. So there is essentially a transition as public health improves in a population. Okay. So, for example, if you looked at population health in what people died of in the United States 100 years ago, 4 of the top 10 diseases that people died of were infectious diseases. Now, if you look at that list, I believe there's only 1 infectious disease in that top 10 list of causes of death, right? So as our public health systems have improved, we've lived longer, and then we're more likely to live long enough that we'll die of these chronic diseases that typically catch up to us later in life, okay? So this is something that we see at population levels. There's also another transition that's worth noting, which is a nutritional transition, which is the idea that as countries develop over time, they're more likely to transition from having things like nutritional deficiencies in terms of vitamins and access to calories and things like that. So lack of nutrition, undernutrition, starvation in populations, to a transition in more developed nations where we actually have what we call overnutrition, which is the idea that people are suffering from having too much access to food, and often food that actually isn't very healthy. So having lots of fats and sugars and salts, which does have an impact on health over time. So we'll actually see that there are these changes over time that we can measure and understand as we look at these population level measures. I'll just give you an example of the epidemiological transition. So for example, if you look at the top, when we're looking at disability adjusted life years, and again, that's life years that have been adjusted based upon the impact of a disease on the health that people are experiencing, right? Well, if you look at the number of disability adjusted life years that have been lost per 1,000 people, well, we see that there's a whole lot of them in Nigeria, for example. But if you look at the majority of them are actually lost for communicable diseases and maternal and neonatal conditions and nutritional conditions, right? So that's where the big hitters are in terms of health impacts for those populations. Whereas if you look at, say, the United Kingdom, well, in that case, the majority of health impact and disability adjusted life years that are lost that could have been saved by preventing these diseases are primarily in the non-communicable disease categories, right? So you can see this epidemiological transition as public health systems develop. All right. So that's some of the ideas around how we, first off, monitor health across populations to see what is going on, collecting that information about who's dying and why. And then how we take that information to combine it to start creating measures that are a little bit more intuitive and that we can use to apply to measure different diseases and think a little bit about how we prioritize how we will be addressing those diseases through public health interventions. So thank you very, very much for listening, and we'll talk more about this later.